hit record. Okay. And good morning, everyone. Wow, this was definitely a day for a remote meeting. I'm really glad that no one had to drive to get anywhere this morning, I hope. So welcome, and we're glad you were able to join us, and we may have a few more people joining, and that's great. So let me give you a quick visual of how our meeting's going to look this morning. We'll do our usual welcome and introductions and announcements, and then we'll move on to our brainstorming, which is the time that you all get to use to talk amongst yourselves. This is when you get to share cases. Maybe they're difficult and you could use some help. Maybe they are updates on a case that you've mentioned before, and we always love to hear those and hope that they're going well. We also love to hear new resources if you've come across any. Anytime you're having a chance to do motivational interviewing, we'd love to hear about that, and also any quality improvement projects or processes you're putting into place. Please let us know about those as well. And once we are done with our brainstorming time around 9, we'll move into the main topic, which is a legislative update. So we'll learn what's been happening in the legislative session so far, and particularly on those matters, of course, that are relevant to the populations that we serve. And then hear, what might be still to come. And we're fortunate to have, for sure, Gina Money, who is now part of the Legislative Coalition for People with Disabilities, and she's watching everything that's happening on the Hill very carefully. And hopefully we'll also have a couple of other folks, although I know they might have had to brave the weather and actually do something in a meeting this morning for the legislature. So Stacy Sanford of the Utah Health Policy Project and Jesse Mandel from Voices for Utah Children. And then we'll wrap it up and call it good by 10. So, all right, this is our chance to do introductions, and I'm going to do my best. Let's see if I can figure out how to do this. Participants, I think this is the better way to do it. All right, so what I'm going to do is just try and go down the names that I see on my participant list. So, Gina, I see you next if you want to introduce yourself.
Hi, Gina Money, or Gina Money, depending on how you've known me over the years. And here as a family advocate, and today from the Legislative Coalition for People with Disabilities.
Thanks. All right. I see a telephone number. I'm not sure if you'll be able to unmute and let us know who you are. It starts 435 and ends 3323. Okay, maybe not. Maybe we can come back around to that one. Next, I see Allison, just Allison. Allison, are you able to unmute and tell us who you are? There we go.
Yeah, I am a care manager at Hillcrest Pediatrics.
Great, glad you could be here. Okay, Alma, are you able to unmute and introduce yourself?
Hi, yes, my name is Alma Estiva, and I'm one of the nurse care managers with the Redwood Health Center, University of Utah.
Glad you're here.
Thank you.
Very glad you're here, Alma. All right, Athena.
Athena Parker, and I'm here with the Medical Home Portal, and I help manage a lot of the resources that are in the Utah directory.
Glad you could make it. How snowy is it where you're at?
Not that snowy actually, but very, very, very cold.
Very cold. Okay. Oh, I'm sorry. All right, Brooke B, I see you next.
My name is Brooke Baystar, and I'm a nurse care manager with the University of Utah out at their Sugar House Health Center.
Welcome, Brooke. Did you have to drive today?
Nope, I'm at home, so.
Good,
Thank
good.
goodness. Thank
Glad
you.
to hear it.
Thank you.
All right, Carol Conley.
Hi, good morning, Mindy and Athena. Thank you for sending this invite. My name's Carol Conley. I'm a social worker by background, education, and training. I am currently in Albuquerque, New Mexico, where we are trying to start up our own children's care coordination network. And so I asked if I might sit in and see how you run yours there in Utah and what little pieces I could put together to really build a robust one here in New Mexico. And I've worked on various quality improvement initiatives with Dr. Norland. I saw his name on here. We used to be part of the National Improvement Partnership Network, NIPIN. So anyway, thank you for allowing me to attend and listen in on your group. I'm happy to be here. Thank you.
You are so welcome. We're delighted that you're joining us, and you're welcome anytime. And yeah, we hope that the weather in Albuquerque is pleasant.
It's been cold. It's been really cold and a lot of snow for us. So that's a little weird, but you know,
Yeah,
change it up.
yeah. Boy, well, I hope you're staying safe and glad you're with us.
Thank you.
And as a matter of fact, I see Chuck's name, Dr. Norland's name next. So Chuck, you want to introduce yourself?
Hi, I'm Chuck Norland, general pediatrician and director of the Medical Home Portal. And nice to see you again, Carol. I'd like to show myself, but for some reason my camera says it's working, but I don't see anything. So I'll remain a blank field there. But welcome. I hope everything goes well with starting up your network.
Yeah, I'm telling you, gremlins in the computers between Zoom meetings. All right, hey Dora, I see you next.
Hi, everybody. My name is Dora Requena. I am the Professional Relations Coordinator for Shriners Hospital in Salt Lake City.
Welcome. Glad you're with us. And let's see, the next name I see is Criddle. I don't see a couple of names there, just one. Oh.
Hi, can you hear me?
Yeah.
I'm a pediatrician down in Price, Utah.
Welcome. We're very glad you're joining us.
Thank you.
All right. Okay. Hey, Eric Christensen, your name's next.
Yeah, sorry. Can never find the unmute button on these multiple platforms. So anyway, I'm Eric Christensen. I manage the Integrated Services Program with the Utah Department of Health Bureau of Children with Special Healthcare Needs.
And of course, we're always glad when you are able to join us, Eric. All right, hey, Erin, you're next.
My name is Erin Shoemaker, and I am an admin assistant with pediatrics. Leaving the portal soon, but I did notice that my person that's coming on, who will be the new administrative assistant, is on this meeting as well, Michelle Redfield. So welcome. And yeah, so I just wanted to see, this will probably be my last one, but I wanted to hand off the ropes to Michelle. So thank you.
Thanks, Erin. Yes, one of my next slides is to explain that this will be your last meeting, more than likely, and we will miss you. So we're glad that you could make it this morning, and we want to thank you for everything that you've done for the Medical Home Portal and the UCCCN meetings. Very appreciated.
Well, thank you, Mindy. Appreciate that.
All right, I see Evelyn on the list. Evelyn's on the phone. It may be that she's not able to unmute, and that's no problem. And you're welcome to use the chat. Well, no, probably not on a phone, right? Evelyn, welcome. All right, Gwen Anderson.
Good morning. My name's Gwen Anderson. I'm part of Eric's team. I cover Emory, Carbon, and Grand County for integrated services and children with special health care needs. Thanks for having me.
Oh, we're always glad when you're able to join, Gwen. Glad you're here.
Thank you.
All right, Haley McLaughlin, someone new. Hi, Haley.
Hi, I'm Haley McLaughlin. I'll put my camera on. Full disclosure, I haven't even seen myself today, but Here we are. I'm the nurse in the adolescent medicine clinic, and thanks for inviting me to join. I just adolescent medicine clinic at the University of Utah and Primary Children's, and the GEMS clinic at Primary Children's. And I'm just happy to join so that I can see what kind of resources sharing and resources there are for kids in our community. So thanks for having me.
Excellent. Well, we're really glad you could join us. Just popping into the chat. Oh, okay, great. Thanks, Evelyn, for finding the chat. So Evelyn is the care coordinator at Utah Valley Pediatrics from the Cherry Tree office. So glad you could make it. All right. Okay, Heidi Bates.
Hey, I'm Heidi Bates. I am, God, you know, I even forgot my title. I'm one of the nurse QI specialists with UPIC. Sorry, it's been a very cold, snowy morning. So.
Yes, indeed.
Yeah.
Welcome, Heidi.
Thank you.
All right, Ileana.
Hi, this is Ileana and Janet, and we're from Southwest Children's Clinic.
Welcome. So does that mean that you guys had to drive to get to the same location this morning?
Yes, we did. It was wonderful.
I'm glad you both made it safe.
Thank you.
Welcome, Ileana and Janet. All right. Okay, I see someone just who shows up as iPhone, but I do see that they're both, I think, joining by the internet as well as phone. I'm not sure if you know who you are, and you can unmute and tell us. Sometimes those things get a little tricky, and that's okay. All right, next, hey, Jade Porter.
Hi, this is Jade with Care Management with the University of Utah Health Plans and Health EU, specifically targeting the Health EU right now. And I'm going to put in the chat one resource that I probably should have known about before, but it's just with the UTA. It's microtransit on demand. So it's kind of like Uber, but it's via with the UTA just in the south end of the valley. And I only found out about it relatively recently. So.
Thank you. I see that you put that in the chat. Terrific. Thank you so much. We'll mention that. Are you able to stay on for the whole meeting, or do you have to go?
I have to go just before 9.
Got it. Okay. Thanks,
Thank
Jade.
you.
Okay. Next, I see Janelle.
Hi, I'm the nurse care manager for Intermountain. I work with several clinics, and yeah, that's me.
Okay. Welcome, Janelle. Glad you're here. All right, Jill Connor is next.
Good morning. I'm Jill Connor, Director of Business Development at Shriners Hospitals for Children. Thank you.
Glad you're with us, Jill.
Glad to be here.
Kelsey Hamadou.
Hi guys, I'm Kelsey here from San Juan Health Department. I am care coordinator under Eric's Integrated Services Program team.
Glad you're with us, Kelsey. Okay, I see Kimmy, and I think Kimmy is just connected by phone. Not sure if you're able to unmute Kimmy. Okay, no problem. All right, Michelle. Michelle Redfield.
Hi, I'm Michelle Redfield. I'm the new administrative assistant working with Mindy. So just excited to be here.
Welcome, welcome. So yeah, Michelle started yesterday, so she's kind of getting baptized by fire a little bit, but we're so glad that you could join us this morning, Michelle.
It's Mindy.
All right, Crystal.
Hi, I'm Crystal. I'm one of the care management assistants working with the University of Utah Stansbury Clinic with Polly.
Excellent. Welcome.
Thanks.
All right, and thanks, Kimmy, for putting something in the chat. Kimmy is one of the nurse care managers for the University of Utah South Jordan. Glad you're with us. All right, Natalie Allen.
Hi, I'm Natalie Allen. I'm the nurse practitioner with Eric's Integrated Services Program, Children with Special Health Care Needs. I love this meeting. I look forward to it every month.
We look forward to having you, Natalie. All right, Nikki, you want to tell us who you are? Not sure if Nikki's able to unmute. Pretty sure Nikki is, I'm not going to say because I'll probably get your organization wrong, but we're glad you're with us, Nikki. Patty Brown.
Hi, I'm a nurse care manager from the University of Utah at the Sugar House Clinic.
Great, great, Patty, welcome. All right, I'm thinking it's Pat Rowe next. Oh, that's right, Pat was unable to talk, so she was chatting before. If you're able to, Pat, we know that Pat is a care manager with Select Health. All right, Polly Grizel.
Good morning. I work with University of Utah Stansbury Clinic. I'm a care manager.
Wonderful. Great, great. Glad you're with us. Okay, and Rebecca. Oh, looks like it. There we go.
Okay, sorry, I muted myself again. Sorry. Sorry, my screen is not working. I don't know if there's like an issue or something. So, but I'm also a care manager with the University of Utah, and I work at the Farmington Clinic. So, and we just got a new pediatrician, so definitely looking forward to these meetings. So,
excellent. Okay, well, welcome, Rebecca.
Thank you.
Very good. All right, Sherilyn. Let's see, maybe Sherilyn.
Oh,
there we go.
There we go. My name's Sherilyn. I am the nurse care manager at Intermountain Pediatrics in American Fork.
Excellent. Glad you could be here. All right, I think Tiffany, I see Tiffany Lambert on the screen.
Tiffany writes, good morning. I'm Tiffany, care coordinator at Utah Valley Pediatrics, Timpanogos.
Great. Hi, Tiffany. Welcome. Okay, Walt.
Good morning, everybody. This is Walt, and I'm a care coordinator on Eric's team with Integrated Services Program, and I am located in the Salt Lake office.
Excellent. Glad you're with us. And then I see Angie Richens.
Hi, this is Angie Richens. I'm the Director of Behavioral Health and Case Management for the Alpine Pediatrics Group.
Terrific. Glad you're with us. And of course, Gabby.
Good morning. My name is Gabi Baragushi. I'm one of the quality improvement specialists at UPIC. And Rebecca, I'm working with Dr. Miller up in Farmington on the depression QI project. So we have a meeting at 12:30 today. If you want to join us, that would be awesome. Just let me know.
Okay, sounds good.
All right then.
You want me to send my email through the chat?
Yes, please. Thank you.
Okay, thanks.
Great. All right. Well, you're already seeing, some of you newer folks, what kind of connections get made at this meeting. So that's fantastic. And I apologize if there's anyone that I've missed, but I think we better jump into the meeting. So we've got a few more participants than usual, and that's tremendous. We love it, but we'll go ahead and move into the meeting now. And by the way, I'm Mindy Tueller, and I manage the Medical Home Portal, and I am the facilitator for this meeting. All right, so quick housekeeping. We'll try and end promptly by 10. And so we are using Zoom now, because everyone's figured out. And if it's possible, it does seem like, it's great to be able to have you mute yourself and speak, and we love seeing your faces if you're willing to do that. We think the best experience is usually with some sort of a smart device or a computer. All right, so as I mentioned before, and as she mentioned before, Erin's going to be leaving us, and we just want to say thank you so much, and we'll welcome Michelle Redfield specifically next time for sure. All right, so we always try and let you know when we've added information or updated information on the medical home portal. And in fact, we have. Since our last meeting, we have put up 2 new pages in our For Families section. So screening for eating disorders and feeding and swallowing problems in children. So we're pretty excited about those and hope that you will you'll want to check those out. So let's see. Quickly just show you where those are. Let's see, is my screen sharing? Hopefully it is. Are you guys seeing the medical home portal?
Yes, we can see it.
Great. Okay, sometimes it's hard to tell. So I think the screen's down here. There's a new one. In fact, we're trying to put more information around eating disorders on the portal in our services directory as well as in our content. Oh. All right, great. And also the feeding and swallowing problems. And then just want to let you know that we've had a special effort recently around all of the kind of educational special ed and 504 plans information in our family side of the medical home portal. And want to make you aware that we've done some updates there. We hope that that will be useful information and useful changes. So this is the subsection now where we've been making those changes. And so we hope that some of these updates will help make more clear the difference between IEPs and 504s and the laws that go along with those and the eligibility requirements and the services that are possible and the processes. So, might want to check those out. All right, well, let's get to our brainstorming time. And again, as I mentioned, this is your time. So if there's anyone who would like to bring up a case and ask for help or let us know how something's going or isn't going, this is your time.
Mindy, this is Jill Connor with Shriners. I just wanted to remind everyone of the great resource available through the University of Utah Project Echo platform. They host educational topics for healthcare providers. And because of COVID, many of the presentations they've been done via Zoom. Today, there is a talk on gastroesophageal reflux in infants and children, and I'll post that link in the chat. In April, Shriners is going to be hosting a talk each week of April, every Wednesday at noon. Topics will include wheelchair seating and mobility, a retrospective study of our department at Shriners. We also have a pediatric plastic surgeon who will talk about ear deformities, ear microtia, plastic surgical cases provided at Shriners for kids, and it's mostly going to be around ears. The third talk will be club feet and pediatric foot issues, and then we'll have a fourth talk on cerebral palsy. So I will provide the link to register, and once you've registered via Project Echo, they will send you just reminders of each talk. And again, those are every Wednesday at noon. So I'll paste the link in the chat now.
Great, thank you, Jill. Yeah, we had Project Echo come and talk to us last year, and gosh, it might not be a bad idea to consider having them come back again. But they're such great resources, so thank you. And we'll make sure that those links get sent out quickly as well. So if anyone wants to join the Project Echo that's going on today at noon. I'll send that link out if you're not able to see it in the chat. Thanks, Jill.
You're welcome.
Anyone else?
Hi, this is Eric. I just wanted to bring up a couple of things, not cases necessarily, but I mentioned last time that we have started through Children with Special Healthcare Needs, a lending library that includes Chromebooks and hotspots to help families who may not have access to some technology to be able to receive telehealth at home or as close to home as possible. We've placed Chromebooks and hotspots in the following locations: San Juan County Health Department in Blanding, in Price and Moab for the Southeast Health District, Central Health District in Richfield, and then Tri-County Health Department in Vernal. We also have hotspots placed and Chromebooks in our Ogden office, and I'm going to say office in air quotes because it's actually with Tony Estrada, my care coordinator there, at her house. And we have hotspots and Chromebooks placed at the Utah Parent Center. So anybody out there who has families who could benefit from having access for a short period of time to help facilitate a visit or visits, they can reach out to our program at Integrated Services, and I'll put our contact information in the chat, and we can guide you to the appropriate coordinator to make that happen.
Thank you, Eric. That's
You're
great.
welcome.
I love to hear that kind of stuff. Okay, anybody else?
This is Dora. I just wanted to, there's such a large group of people on here and there's a lot of new people. I'll just wanted to remind everybody of our new fracture care hotline that we have at Shriners Hospital. I'll put the information on the chat, but it's you can call or text this number, and it's they triage, splint, cast, surgery, post-fracture follow-ups, and rehabilitation all under one roof. So I'll just put that information on the chat. If anybody has any questions, I'll put my contact information underneath as well. Thank you.
Thanks, Dora. All right, anyone else? So maybe I'll just revisit the ride share that Jade Porter posted before. I know we have that information in our database. Might take me just a second to find it, so I probably won't take that time right now. But yeah, there are more and more, it seems, of these kind of ride share opportunities, and so the UTA one in particular, I think, is relatively straightforward, and I think it's quite inexpensive, so it can be used just on an as-needed basis, and it is kind of like an inexpensive Uber. So we'll make sure that that's highlighted in the resources of the month summary that we send out as well.
This is Gwen from Urban, Emory, and Grand, and I just wanted to, I'll hustle quick. Recently, I had a family yesterday use the Logisticare. It's no longer Logisticare. I can't remember the name. They drove down, went to Moab, picked up a kiddo, took the kiddo to surgery, emergency surgery in Price, and they were great. They did a will call so that they hung around. So when the family was discharged, they were able to get a ride. So from Moab to Price, it's about a two and a quarter hour trip, and they were really easy to set up. They do have to have a Medicaid coverage, but it worked really well for us.
I'm so glad to hear that, Gwen. If you're able to recall what it's called now and let me know, that would be helpful.
I'll go get my notes.
Okay, thanks, Gwen. That's great. We appreciate you sharing that kind of information. All right, I don't want to cut this time short. If anyone else would like to talk, you're certainly welcome to. Yeah, we do always like to ask, how is everybody doing with COVID? It's sure stretching on, isn't it? Anybody has any updates of how they're coping, you're very welcome to let us know because it might help someone else.
I can't speak for anybody else, but I tell you, I have a certain peace of mind, not that you can during, unknown COVID times, but having received both vaccinations, I'm hoping I'm a little bit ahead of the game. So I do feel a little more optimistic. And definitely with warmer weather we had a couple of weeks ago, I felt like, spring was here. That's all gone out the window this morning, but good weather and COVID vaccinations certainly improved my mental health.
I'm so glad to hear that, Eric. Yeah, are others getting both of their vaccination shots? It's quiet. Well, I hope you all are if you're able to. And yeah, I think there's hope, right? But it's still a difficult time for sure. And we hope you're all taking care of yourself the best that you're able. All right, let's go ahead then and move into the main part of our meeting. And Gina, if it's all right, I'll just go ahead and let you take the controls.
Okay. Just when I think I have it figured out too. Okay, I am going to go down to a slide that has the health policy project on it because I know Stacy is on with us and I'm going to let her talk about the Utah Health Policy Project and want to thank her. And I was going to ask Erin and Mindy if you'll watch for Jesse so that I don't cover the screen with the participant list. And Jesse's going to try to join us, but how legislature goes this morning, their main bill is being heard, and we'll talk a little bit about that in a minute. But Stacy, are you okay to start talking about the Health Policy Project and what's going on with some of the bills that you're following?
Yes, absolutely. Thank you for having me. And I apologize in advance for my cat because he's a little rambunctious this morning, so he might be interrupting us. But I'm Stacy Stanford. I'm the health policy analyst at Utah Health Policy Project. I got my start in my career many years ago in long-term care, and then I was disabled and kind of needed to shift gears to accommodate for my own health issues that came up. And so now I do health policy advocacy, and I've been at UHPP almost 4 years now. We are a nonprofit, nonpartisan organization that focuses pretty broadly on how we phrase it as sustainable health solutions for underserved Utahns. So we work on a lot of different healthcare issues, really with the patient first perspective. I come from a disability rights background, and so I'm very much in the, nothing about us without us mentality. And so that's kind of how we choose the policies that we advocate for, what our priorities are. There's other groups that fight for doctors. There's other groups that fight for insurance companies, things like that. We really are thinking of the patient first. And then we also have a team. I work on the policy end of our team, but I have about 20 coworkers in a project associated with Utah Health Policy Project called Take Care Utah. And they do direct service. So they sign people up for health insurance, walk them through the Medicaid application, the CHIP application, through Obamacare or the ACA marketplace. And then beyond that, what we call kind of the coverage to care piece where we help people find doctors or specialists or, kind of navigating once they're in the system. And so we do both ends of that. And so I do need to shout out that there is a new open enrollment period happening now. If you or anyone you know needs health insurance, needs to change their ACA plan, anything like that, we can definitely help you out. It's a 3-month window, which is very exciting. We've been advocating for this really since the beginning of, oh, thank you. I'm glad you love Take Care Utah. But we've been really since the beginning of the pandemic saying you've got to open up the marketplace. People need health insurance. So we're grateful to see this finally happen. So it'll be open from February 15th until May 15th, and that's for the healthcare.gov plans. Of course, Medicaid and CHIP are open all year round. And I talked to the director of our Healthy Kids team, before this meeting to see if there was anything that came to mind that she would have me add. And she just said that 80% of the families that we serve through our Healthy Kids program are Spanish-speaking families. And so if you know people that need translation resources in navigating the healthcare system, that's a big part of what we do. And we know that this year has been particularly challenging for families kind of at that intersection of disability and immigration status or language that they speak or, things like that. So we know that those challenges have been even harder there. We also refer out to a lot of resources. If we can't help, then we try to connect to an organization who can. So all that introduction, I'll pivot into some of the bills on our list that came to mind when I was thinking about, kids and healthcare and kids with disabilities or special healthcare needs and things like that. So I have them just kind of in order. There's some I'll spend a little bit more time on than others, but HB 81 is mental health days for students. And this is, something that is important to address, that kind of invisible illness side of things that can come with behavioral health or mental health challenges, or maybe just having a bad emotional day and needing a break from school. And so this gives kids, a non-physical illness way to get out of class. And I know there is another bill that I can never remember the number that also is just saying, okay, maybe they just don't need a note at all from a doctor. And maybe they can just say, hey, my kid needs a day off. And then after, a day or 2 or 3, then a doctor's note comes in. But so there's some bills trying to address some flexibility with school and mental and physical healthcare needs. HB 206 is the twin sister of last year's HB 207. If you followed the insulin price legislation last year, this is her twin sister. So this is epinephrine auto injector access amendments. And it's the exact same program from the bill last year that provided a more affordable option for insulin. This does the same thing, but for epinephrine, like EpiPens, basically the name brand auto injectors, because we know that generics can be really hard to find and the name brand is very expensive. So this is making that more accessible. And that is well on its way. It's past the second reading calendar and it looks like it's now just kind of waiting for that final vote. The bill that might be the most excited about this year is HB 262, and hopefully Voices, Jessie will join, and this is her expertise, but this is children's health insurance amendments. And this is trying to figure out why we have one of the highest rates of uninsured children in the country and trying to solve it through, outreach and enrollment efforts. And so it has some research pieces on why are people disenrolling, what's the most effective type of outreach, and then it also has dedicated funds that would go toward outreach efforts for children's health insurance. HB 337 is child mental health amendments, and this does several different things kind of in one. The overall theme of it in my mind is kind of recognizing that even very young children can have mental health issues. And so it's establishing kind of a system with childcare providers of best practices to deal with, mental health issues and recognizing and addressing that in very young children. Setting up a fund, it looks like, for some treatment options for very young children. So it really is just kind of recognizing that even our youngest kids can sometimes have mental health challenges. And that is just getting started. It was just introduced and it has not even been assigned a committee yet, but something that is exciting to keep an eye on, I think. A bad news bill is HB 344. Sometimes we have to track the bad things too. This is called Program Eligibility Amendments, and it just builds a whole bunch of new walls in between families and Medicaid, and means that there's all kinds of new checking of eligibility, different programs that have to review eligibility status, that have to review more frequently, that hospitals can no longer do the presumptive eligibility for certain people, really just making it a lot harder to get and keep Medicaid. And the upside is that all of these changes would be very expensive. And so we're hoping that it will die because of that price tag, but still something that we can't count on. And so we're watching that with great concern. Another brand new one is HB 363. So this was just introduced and has no committee assignment or anything yet, but this is Medicaid for new mothers. And so this is a really great postpartum Medicaid program that would extend postpartum Medicaid for 1 full year rather than, I think it's only 6 weeks currently. It's a very short time period. And we know one of the biggest keys to maternal mortality is extending Medicaid coverage. And so this is very evidence-based. It would go up to 200% of the poverty line, which is above the typical Medicaid threshold. And so this is an excellent bill, which unfortunately means it probably is going to be an uphill battle, but would be just fantastic if we could get it done. Several states have already done this, and it's just such a great program. One that I know that we've talked a lot with the Legislative Coalition for People with Disabilities is the state agency realignment and the plan that the governor has discussed, wanting to merge the Department of Health with the Department of Human Services, and create kind of like a big mega department instead of the 2 separate departments. And this is one that we can't really say we're 100% opposed to the idea, because there are obviously ways that communication could improve. There are silos and different programs that could be broken down. There are a lot of ways that things could be made better in both of those departments, but they're moving really quickly with saying that the merger is the only option when they haven't even discussed, are there smaller ways to reorganize things? Have they talked to the people who work in the waiver programs for the kids, for disabled folks, for seniors, to figure out what needs to happen? And it's just very complicated, and it seems like it's almost the answers being given before the question's been asked. And so our position on this has been to push it to an interim study and put it on hold and then figure out the details. And so that was just introduced. We've met with a lot of representatives and senators on this, and it'll be interesting to see where it goes. Nobody seemed to know much about it, which could be a bad, which could kill it, but could also mean that it gets passed without a lot of buy-in. So we'll see where that goes. I have just a couple more, sorry. Another brand new one that just came out yesterday, I believe, is HJR 13, House Joint Resolution declaring racism a moral and public health crisis. And so this is pretty much what it sounds like. It recognizes racial health disparities, the reality of systemic racism in the health of people and in public health, and vows the state to, I can't remember what it's called, but there's like a compact that has some benchmarks and goals for racial equity and addressing systemic racism. And we know that that's a huge issue in healthcare and in health policy, and the quality of health for our families is the way the system and the world around us is just designed to treat people differently, sometimes based on the color of their skin or where they're from or other barriers or things in their life. So I think that that's just so important that we're taking that step to recognize that. Switching to the Senate, just a couple from the Senate. SB 103 is dental hygienist amendments. And so this is a little flexibility with how dental hygienists can bill in public health settings. And so basically what that means is it could have more flexibility for providers, which means more access in rural areas for higher need populations, lower income populations, things like that. So a good step forward in improving access to dental care and recognizing that teeth are a part of our body. SB 128 is family planning services. This is, I think, the 4th year that this bill has run to try to expand Medicaid coverage for contraceptives only. So it would be kind of a separate Medicaid package for those above the Medicaid expansion threshold that would pay just for contraceptives. And this is, really important for maintaining health. And then it would also cover teenagers too, would be part of it, that if there are teenagers that have ovarian cysts or something, that, they could have coverage for their, issues as well, which I think is really important. We have to remember that contraceptives are for far more than just preventing pregnancy, and that's very important, but it's very much a piece of healthcare. And so we're excited about that, and it has been tabled, so not sure if it's going to go anywhere else, but it is, once again, part of the conversation. And then just the last one that I know is being heard right now, I haven't gotten a message about it passing or failing yet, but is Senator Escamilla's kids coverage bill. And basically what this is, you might have heard of the 100% Kids Covered Coalition, or there was some media coverage about efforts to cover all kids. This is Senator Escamilla's bill that would, open up coverage to all kids up to, I think it's 200% of the poverty line. Also has some great outreach things in it, and just an incredible piece of legislation that would be great if we could get across the finish line. And they are discussing it literally as we speak. So that's how these things happen nowadays. So hopefully Jesse will hop on in a minute and tell us that it passed through committee and we'll get to go to the Senate floor. But those are all the ones that I had pulled out of my list to highlight. We have plenty more. I think we're up to 60 something on our tracker. So take a look. There's a lot of mental health ones on there that I don't have a lot of bandwidth to focus on, unfortunately. So, but there are other great groups doing that kind of work if you're interested specifically in mental health type legislation. But yeah, thank you for having me.
Thank you so much, Stacy. And when I mentioned before, it was Stacy's last point on Senate Bill 158 is why Jesse is not able to join us at the moment. That's one of their big bills that they have priority for. And just so that you know, Utah ranks 46th in the nation with our high uninsured rate of kiddos. And this session, we have that opportunity to reduce the barriers and get kids 100% covered. This also, to add on to what Stacy said, it provides some state funds for kids that may not be eligible due to their immigration status, and funding for outreach and continuous eligibility for all kids. So when I was thinking about some of the bills and such to let you know what's going on, and basically from a lot of when we discuss cases and such, many of the issues that you as care coordinators come across are because they can't get access to health insurance and Medicaid and all of these other things. And we definitely know that our underinsured and the immigration status has really put a damper on getting some much needed services for some of our families. So we're waiting with, we're holding our breath and hoping that that can move forward. And Stacy, I don't know if you all took a position. I know that we absolutely opposed it as the Legislative Coalition for People with Disabilities due to all the mental health issues with both children and adults, but it sailed right through and actually passed, and the governor signed on Monday, and that was the concealed firearm amendments. And that was just unfortunate for all of us, because we absolutely know that that with the mental health piece and all of that, that is a huge concern for our families and our individuals. So I don't know, Stacy, if you guys actually ended up taking a position on that.
We didn't on that one, unfortunately, but yeah, I mean, we know that when you have a firearm, the likelihood of a completed suicide goes way, way, way up. And so it's very alarming when you increase access to firearms, then you increase that risk of a suicide being, completed, where sometimes the argument against it is a little crass, but they'll say, oh, well, if they were going to do it, they're going to do it anyway. But attempting with certain means and attempting with a gun are very different things. So yeah.
And then there was also another one that it has not passed, but we are opposing. And just to kind of take a step back is when, I don't know if those of you that voted, seen that on the ballot, there was an Amendment G on there, and how it was written was that it would give extra funding for disability services, and it was out of the education fund. And how it was written, it looked really appealing. So most that don't know how legislation works and all of that, of course, voted for it. And those of us that have been intimately involved with that realize that this could be a big issue. And we're seeing some pros and cons from that, because Amendment G did pass. So one of the first things that's good is, let me hurry and find where it's at, is that it will increase the weighted pupil unit for special education, which of course is wonderful, because it will give access, if it passes, to more funding in special education. And I know that there's, and I don't know if there's a bill number, and Stacy, you may not know this either, but it's for intensive services, and it's for those school districts or the local education authorities that have kids, youth in their schools that have the intensive needs services. This has not gone favorably as far as extra funding. So we're kind of following that. Another thing that is, there's House Bill 42. And unfortunately, again, it's another one of those that in how it's written up, it looks like, that it's a good thing, because it's the Education Agency Report Process Amendments, which looks good because of, they're studying it to make sure that there's not more paperwork involved than needed, but it also eliminates funding to help school districts cover part of the cost of 504 accommodations, which is huge for us, because we know if our children and youth can't get an IEP because they're not qualified, if they have extra needs, they can definitely get that through a 504 accommodation. And so this is, and it's a mandate, it's not a funded mandate. So to take away this little bit of money, which is only like $513,000 to help those school districts cover that. So that's one thing that we're definitely opposed to. And while I'm saying this is, though all of us are working kind of on the same things, I just wanted to mention, so you see on the screen that Stacy's organization, the Health Policy Project, I've kind of highlighted right there where you can go in and find their tracking sheet for the 2021 session. And they also provide, you know, kind of the information on it, but the Legislative Coalition also does that. The Disability Law Center does that, as well as Voices for Utah Children, so that you can kind of get, without having to go to the legislative website, which I have to say, our state does a pretty good job with the website for the legislature. But if you don't know what you're looking for, it makes it a little bit challenging. So having these organizations all work together and with each other, and then having them on their websites, it makes it very easy to find. There is also, Stacy, when you said about being able to take mental health days off, there is that counterpart, and I've seen it as you were talking, that allows so that you as pediatric offices are not having to try to keep up with the notes for to, you know, excuse the absences for children. And of course there is those safety nets built into that. So if a child's gone for more than 3 or 4 days, then absolutely to make sure that child's okay and such. And so that will help, because a family will not have to come back to the pediatrician's office or the family practice office to get a note for missing a mental health day if that truly passes. So any questions at this point? I'm gonna look at, I just have to say, I spent a lot of time. I do have a PowerPoint, just in case both Stacy and Jesse were not able to be on here. I was prepared. So I just want to go back a little bit. But in the meantime, if there's any questions for Stacy or myself, it would, now's the time. Here is Voices for Utah Children's website. And of course, I'm hoping that Jesse will be at least letting Stacy know what happens with that bill, because everybody's waited with bated breath. But here is on their website, utahchildren.org. You can go to their legislative center, and you know, the drop down, that's where you will find their legislative bill tracker. And again, I have a few little slides on basic civics and such, because I think that even for me, being involved for as long as I have with the Legislative Coalition, really didn't realize the process of the readings and such. And so that, I think that's why it took me by surprise how fast that the Concealed Firearms Amendment passed. But here is the Disability Law Center's page 2, and it went down, so you don't get to see where their bill tracker is. But if you go to their website, which they also, this is all on disability issues, a lot on mental health and such. And if you go to their website, you can click on that, how we do it. And then there's the public policy. Pictured right there is Andrew and Nate. They have done some video chats with people to let them know what's going on, as well as using their bill tracker that's at the very end of this sheet. So again, great information that really truly affects all of the families like mine and all of the families that you guys are serving. And one of the biggest things I wanted Jesse and Stacy to talk to you a little bit is, we know how many of our families fall through those cracks for whatever reason that is. And there is a way to let you know, our policymakers know and have help in advocating for their needs. And that is absolutely by working with Utah Health Policy Project or the Disability Law Center. And the ones I don't have on here are, you know, also families calling the Utah Parent Center. Many families call to work through their school process and such for their IEPs and 504s, but they also are very active in watching the bills and what happens to families like ours. And then the Utah Developmental Disabilities Council also does that as well. And both of them have advocacy trainings for families. But we know that if we're not letting all of you know and families know what's going on, a lot of the time, some of the most important legislation pieces don't happen, or they do happen. And it's not necessarily for the good or the bad, depending on what the circumstance is. And so I don't know, did you want to add anything to that, Stacy?
I would just add, I send everybody to the DLC website. So if you're interested in like getting started in any of this, or like, I don't know, they have so many resources that are helpful, really, no matter what your level of understanding is with the legislature. I still refer to them. So definitely recommend DLC as a resource.
Thank you. And then here is, we do have a website. It's under construction, so I did not put on here. We're kind of rebuilding. Legislative Coalition for People with Disabilities, sometimes known as LCPD, has been around for quite a few years. I want to say they're going on 30. And it is a total volunteer organization. So we have a chair, 2 vice chairs, a secretary, and now a treasurer and a development person, which is me. So we are definitely looking and working with all of our advocacy partners, as well as with state agencies. We have, not during the legislative session, we have monthly meetings to let families, agencies, and other partners kind of talk about what's going on, what's coming up. During the 45-day legislative session, we meet every Monday from 12:30 to 1:45. The time is very specific, as if we were in a typical year, knowing we're not in a typical year, but that we end at 1:45 because committee meetings usually started at 2, and most people were up at the Capitol, going to those committee meetings so that we could be seen and heard. This picture is just to show how important it is for voices. This is when we got the medically complex children's waiver passed, with families that put themselves out there, gave their stories and such. And I've been able to be a part of passing quite a few, which will show my age, but the Travis Sear waiver that for technology dependent children was one of them, one of the very first, I guess, baptism by fire for me. And it was truly the Legislative Coalition working with the mom, Stephanie Carlson, on the needs of families like hers, like mine, that had children that were on life support, which, kind of went then to not just ventilators and such, but also other technologies, trachs and such. And what was nice about that was I was in, what these waivers do is I was in that situation that even if you're $1 above whatever the federal poverty level is for that program and what your family composition is, you cannot get services. And when all of this started, we did have insurance that they looked at pre-existing conditions, so we were uninsurable. So when the technology dependent waiver passed, it truly changed my life. And I think that's why I'm still here and still involved, and wanted to do that, even though I don't have children now that need the MCCW and such. It was important to work with other advocacy organizations as well as families to make sure that we were truly meeting the needs of families with some of the most complex of issues. And we know that there's still issues with getting families on to that waiver, but at least it was a step in the right direction. And by any chance, has Jessie come on, or have you heard from her, Stacy?
Looks like they're still going. So
Yeah, so it might be that Jesse is not able to be with us today because they are fighting hard to try to get 100% of kids covered. And I think one of the most important parts of that is of course, for the immigration status and such, using state funds, and then that continuous eligibility. And Stacy, can you explain what that means?
yeah, so currently there's kids on CHIP, once they're into the program, only have their, renewal, or, they have that opportunity to lose coverage only once a year. For kids on Medicaid, it's every month. And so we're constantly having kids cycling on and off of Medicaid because income is fluctuating or things are changing. And so it's really essential that we also get that 12 months of continuous coverage for kids on Medicaid and on CHIP, so that they have that stable bridge instead of constantly falling through the cracks. And luckily right now we do temporarily have that for all Medicaid enrollees, by the way, because of the COVID pandemic. So anyone on any Medicaid program cannot be disenrolled for any reason during this period, except for, oh, Jesse's there on the Hill. Sorry, I just saw her in the committee room. But so nobody can be disenrolled right now due to the pandemic. And we've just seen, finally, for the first time in years, our kids on Medicaid rate is going up slightly instead of how it's been going down for the last few years. And so we're seeing that it makes a difference to keep those kids covered. So we hope that the legislature will fund it again this year like they did last year, so that we can have that program in place. And that was a separate appropriation, as well as in the Escamilla bill. So if, heaven forbid, that bill doesn't pass, there is that other option that we could still maybe get that continuous eligibility through an appropriation.
Thank you. Okay, I'm just going to mention a few that are exciting that I know that, again, from case scenarios in the past, that would help, hopefully, all of our families. There is one that I will say that we're following, and I think others are as well, may even be, approving it or supporting it. There's a Senate Bill 63, which would allow Medicaid to pay a spouse for providing extraordinary personal care to a waiver enrollee. It's a great piece of legislation. This helps for those that have a spouse with dementia or other significant healthcare issues and such. It came about last year. We really, really opposed it because we really wanted it to be opened up to parents of at least adult children that had extraordinary needs, because we do know that many of our families, after they turn 18 and they're an adult, and it goes from entitlement basically to eligibility, that their disabilities don't change, their extreme healthcare conditions don't change. And so what we were faced with is, do we totally oppose, or do we support this? Because if they study it and find that it really is a great return on investment, which is the key word, it would open up the door to have paid caregivers for those families that are taking care of now their adult children with extraordinary healthcare needs. So that is one we're watching pretty close. It does come with a almost $3 million price tag, so we'll see how that goes. The other one that we have decided to follow and not necessarily support, it's a great concept, and it's from Representative Eliasson, and I think he started out with it last year as well. And this is what's been interesting for this year, is that everything that was passed last year, of course it was before COVID hit. So we are doing a lot of makeup and wondering if, that funding still going forward, such as early intervention really needed 1.5 million last year. It was passed, but then of course held after COVID hit. So we're trying to find out the process of that. And I know that that's going forward and we'll see how that ends. But we're also with Elias, and he come out with an idea, and this shows you that even for those of us that have disabilities or family members with disabilities, every family is so unique and not everything is the same. So we have to really get all voices from everybody. He wanted to do a medical verification that allowed individuals to ask the DMV to place a sticker or other mark indicating that they have a disability on the back of their license or identification card. And he really feels like it could help those with invisible disabilities who interact with law enforcement. And we know that that is a big thing this year, especially. But from some individuals with disabilities, there is a huge concern about the potential to identify and discriminate against residents with disabilities. So we as the coalition decided that we don't oppose it. We're not supporting it. We'll follow it because we can see the pros and cons on both sides, and really let that play out and let constituents really give their stories and such with why they want it to pass or why they don't. The other piece is House Bill 130, if an insurance plan includes mental health coverage, it requires, and Stacey, you might have mentioned this one, it requires it to be equivalent to the plan's medical and surgical coverage, which is great, because as Stacey said, we are still fighting that big battle that mental health and oral health are a piece of the same body and should be covered and treated in the same way as the rest of the physical health and coverage. So it requires that also requires that the insurance commissioner to enforce federal mental health and substance use coverage parity. So what I'm thinking about that, and I may be wrong, is one of the things that happens here in Utah, which some of you may know, some of you may not, is that when we do have a mandate for insurance coverage, unfortunately, those mandates only cover around 25 to 30% of the population, because another 70 to 75% are what's considered ERISA plans or self-funded plans. And so they actually, the oversight is by the federal government. And so there's been a lot of misconception that once the mandate passes, that all insurance companies have to do this. So the way that this one is written, I'm really hoping that it can help regardless of what type of insurance plan you have, but I could be wrong on that one. This one is really exciting because we know how many children, individuals with an autism spectrum disorder we have in Utah. And some of the, especially for children, some of the biggest issues are if they have CHIP. They cannot get coverage for like ABA. They do not cover autism services. So Representative Dunnigan has a bill to require CHIP plans to cover ASD. And it comes at a price tag of a little over $2 million. But we know that that one would be huge because we see families that cannot qualify due to income for Medicaid, but they are on CHIP and CHIP won't cover those. So really watching that one. As well as House Bill 309. It is creating a refundable earned income tax credit at the state level. And if so, Utah would become the 30th state that we could have our own earned income tax credit, which would be huge for families of children. We also, you talked about that one. This one, Senate Bill 70, with Substitute 1, requires the Division of Substance Use and Mental Health to work with the local mental health authorities to establish 14 mobile crisis outreach teams across the state by 2022. And to go along with that, Senate Bill 155, and that creates an account which can be funded by tax dollars and donations to support the implementation of, and I don't know how many you've heard about, the 988 line for suicide prevention, mental health crisis, mobile crisis outreach, and receiving centers. That one would be huge. I know that even at our federal level, Stuart has talked a lot about 988 and would be kind of like trying to get into everybody's kind of normal day-to-day. We know what 911 is, and trying to get 988 into everybody's kind of, for lack of better terms, vocabulary, because we do have a lot of issues and heartbreaks with suicide and mental health. And I think that's what I had on here. So anything else, Stacy? And if not, I'll go back and just kind of do some of the kind of what's going on up there and how it happens.
Oh, I think you added some great things that I left out. So good job.
There are so many.
Yeah, no, you were right on with the mental health parity stuff. There is also bills that look at like telehealth mental health parity. So kind of addressing telehealth services equal to, you know, in-office services for mental health, because you really can have a good therapy session over Zoom. And so that expands access for, you know, people with disabilities, for rural areas, things like that. So it's exciting to see some movement in both of those areas. And good news, you guys, it sounds like it passed out of committee. So I think SB 158, is on its way to the Senate floor. So that's a really pleasant surprise. So yay.
Thank you. Okay, well then we know that it might take, if Jesse's able to come on, and I know we're running out of time. So I will send these slides to Mindy to put in the notes, because there are some good things in here about what the process that it goes through. And just so you know, of course, we're kind of getting towards the end of the session. It always starts the third week of January and ends the first week in March, which this year, I think it's the Friday, the 5th. I believe that's what it is. So it's coming right up. And of course, interim meetings are year round. And I won't play this, but when you get the slides, I encourage you, if you want a good laugh, to watch this Utah House of Representatives wrap. It is so funny, and it's from a couple of years ago, but it is just funny to talk about how a bill becomes a law in Utah. And I also put this picture on because it does show, of course, our current status with everybody with the plexiglass and their masks. And this is a really good visual on exactly what it takes to actually pass a bill. And, you know, that it's got to go through, regardless of which house it starts in, whether it's the Senate or, you know, the House, they have to have 3 readings. The process may be different for each of the houses, but you can see on this, you'll have this as well. And what I didn't know, this was new to me, because I'm so used to some of the federal legislation that, you know, when it goes to the governor, he doesn't necessarily have to sign it, and it will still go into law as long as he doesn't veto it. And that just shows that he doesn't totally support it, but he's not going to veto it. So that was new to me after all these years. There's some, like I said, the great website. You can sign up for an account, so that if there's any of these bills that we talked about, and I also have a sheet of those that you want to track and see what's going on, you can sign up for an account, and it will tell you anything that's happening with that and what reading it's on and such. Here's another one that you can track. It shows the floor calendars. It shows their voting boards and, you know, where the second readings are. And if you just want to go to their main page, because it's like, I don't want to go through all of that, but like this morning, it showed that the Senate Bill 158 was going to be heard. So you can just go to the bottom of the page, the calendar, click on the date, which this was this morning's, and it will show the any information. They have public comment on here that can be done virtually now, of course, with the agenda. And like this morning, here is the agenda and where our bill with Senator Escamilla is on there. And if you don't know who your local representative senators are, you can just enter your address and zip and it will tell you, because we do from all of our agencies, organizations, we say, you know, it isn't said enough that if you just, even if your particular legislator is not on one of these committees that's making these decisions with appropriations and such, still letting them know your concerns, because they all interact and they really want to meet their constituents' needs. Here's communication with your legislators. If you are one of their constituents, make sure you say that you're a voter in their district, because that gets you a little bit further. I have found that the communication with the legislators during legislative session is a little bit tougher. So sometimes, and on their websites, you can find out who their interns and their Senate staff are. And sometimes that might be the easiest way during these times of everything being virtual, since you can't send a note in to them right now. And many of you can find the legislators on Facebook, Instagram, and Twitter. And many are on Twitter, where they're doing real time as they're in their meetings and discussing the issues that we all care about. And there's a quote, another quote. And just for your information, I put in these for our federal representatives. And the reason I do is because many of the times, some of the things that come down to the state really started at the federal level and need their support. And what I will say in closing is that they all have their different formulas, but whether it's your state representatives or your federal representatives, they have a formula that they use that if they hear from one person on an issue, locally, they can say that represents another 10 to, it just depends on their area, you know, to 100 that are having those same issues. And in DC, if they hear from one, it's even a larger, you know, where they think, okay, another 100 constituents are dealing with that same thing. So we found that even having as few as 10 people contact their legislators makes a huge difference. And, you know, the personal stories and what we all live with day to day is what is needed for them all to hear. And I know that we are at time. So any questions or last thoughts, Stacy?
No, thank you for having me.
Thank you.
Thank you so much. That was such great information. And I think this is just such an eye-opener every year to recognize how much work is going on and how much you guys need to pay attention to and how much we all should be paying attention to. So thank you very much for helping us to know where we can go to track some of these issues and how we can also make our voices heard. I do think it's really important for people to know that you do need to reach out to your representatives and let them know what you're thinking in order for any change to ever happen. So if these are important to you, you are very much encouraged to reach out. I do know that while Utah is behind in some other things, they're quite ahead in, for instance, their online presence and their ability to have that information made public and involve the public. So we should take advantage of that. And such good news to have happen in our meeting this morning. That's wonderful. So it's not out of the woods, but it's moved over a huge hurdle. Yeah, excellent. Okay. All right. Well, I think that we'll go ahead and wrap things up. But just to let everyone know who perhaps is new on the meeting, we do send out a summary of the meeting, and it usually comes out a couple of days after. It will include everything we've talked about and everything that was put in the chat. It will also have links to the important and appropriate websites that were mentioned here. And then we'll link to the slides overall, and we always record these as well, so you can go back and watch if you need to or if you missed it. So thanks so much, everyone. It was a great meeting, and we really appreciate everybody's time, and stay safe in all the ways. And let's see, I'll just pop back out to my slides here real quick. Our next meeting happens to be on St. Patrick's Day. So we'll look forward to you all wearing green when we see you on the screen next month. So, all right, guys, thanks so much. Take care. Bye-bye.
Thank you.